8:16. Now, I remember years ago I learned an expression I'd never heard before. I slept hard last night. And it's like, what does that mean? Slept hard. It means they slept well. Well, more than 1 in 3 American adults do not sleep hard or well. They don't get enough sleep. Dr. Brent Wallace, our friend, Chief Medical Officer of People's Health, joins us to talk about why that's a problem. Plus, he has some tips for us for a better night's rest. How'd you sleep last night, Dr. B?
Hey, Tommy. I actually did pretty good last night.
Had you heard the expression, I slept hard, before or not?
I have. Yeah, definitely. I hear it all the time.
Really? Okay, so how much sleep do we need?
Yeah, you need a lot more than most people are getting, actually. The CDC actually recommends that adults are supposed to get between about 7 and 9 hours of sleep per night. And it's that range because sleep needs they're going to vary person to person, depending on who you are. Some people may need a little bit more, some people may be a little bit less to wake up and really feel refreshed. And then keep in mind that as you age, your sleep needs may change a little bit as well.
How do we know if we're getting enough sleep?
Yeah, really that high quality or hard sleep, like you were saying, should give you the full benefits of that 7 to 9 hours. If you're sleeping really well and for long enough, you should wake up in the morning and feel really rested and restored and actually a little bit energized. And, the contrary would be if you wake up feeling really tired or foggy. Even if you think you got a full night's rest, you might not be getting really good quality sleep. It may be lower quality sleep. And some things to watch for, if you have difficulty staying awake during the day, that's something to be really concerned about. A lot of people may have problems concentrating or remembering things or even having conversations first thing in the morning. And then some people actually may have trouble controlling their emotions, kind of like a toddler when they get too tired.
What causes poor sleep, doctor?
Yeah, it can be related to a lot of things, but sleep habits are really, really critical. Some of the things we do actually cause poor sleep. So if you're drinking a lot of caffeine right before bed, obviously that's going to not set you up for a really good night's sleep. It's going to keep you awake. And then some people, it may be related to things like stress and anxiety. So you're trying to go to sleep, but your mind is really active and thinking about all those things you're stressed out about. We call that rumination. There are some health conditions and additional, things like breathing problems or in particular chronic pain can cause problems with sleep. And then you could have what we call an actual sleep disorder, and that's a medical condition that needs to be diagnosed and treated, and often they're not treated for certain patients.
What is a sleep disorder?
So really a sleep disorder is any condition that keeps you from getting restful sleep, and there are a lot of them. It's very normal for people to have trouble sleeping from time to time. But if it becomes a really consistent problem where night after night you're having difficulty either falling asleep or staying asleep, that may be a sleep disorder. And so the most common one that we see is called insomnia. And a lot of people know what insomnia is. They may not realize, though, insomnia could be that difficulty falling asleep. It may also be where you wake up in the middle of the night or maybe too early in the morning. That can also be insomnia. And then one of the other ones we see really frequently is something called sleep apnea. And sleep apnea is a medical condition that actually causes you to stop breathing while you're sleeping. And it could be a physical thing, like an obstruction or a blockage in your airway. Often it's either large tonsils or maybe a really large tongue that kind of stops you from getting air in. Or it could be more central, where your brain is not controlling your breathing correctly. And that lack of oxygen that occurs will trigger sort of your survival instinct, and it'll wake you up from sleep very abruptly.
Is that something you should talk to your doctor about, sleep problems?
Yeah, absolutely. And this is something when you come in for your PCP visit, you want to definitely bring this up with your doctor. Your doctor may check to see if those are related to a health condition you have, or, they could even be a side effect of a certain medication you're taking for a different medical condition. And if we think you might have an actual sleep disorder, often we will refer you to get something called a sleep study. And what a sleep study is it's a test that we do overnight. It actually can be done in your home, or it can be in a sleep center. And what it does is it monitors your brain activity, your oxygenation, your blood pressure, all those bodily functions while you're sleeping so that we can try to make a diagnosis.
Now, let's take a break. More with Dr. B from People's Health when we come back about getting enough sleep. More than 1 in 3 Americans don't get enough sleep. There's a millennial that works for our company here in this building that started doing a morning show a couple of years ago. And they asked me, what's the trick to getting up at 3 o'clock in the morning? And I said, there is no trick. You're going to be tired for the rest of your life. 821 traffic now, WWL. 826, Tommy Tucker, WWL, back with Dr. B, our friend Dr. Brent Wallace from People's Health, Chief Medical Officer at People's Health. We're talking about sleep, how important it is to get enough sleep. 1 in 3 Americans do not get enough. So, Doc, what happens if you don't get enough sleep?
Yeah, I mean, in the short term, it's going to make you feel tired. It may worsen your mood. You might even have trouble making certain decisions. But long term, it can cause a lot more complications. Things like, weakening your immune system and making you more susceptible to infection. It can increase your risk for depression and anxiety, and it can actually cause certain health conditions like high blood pressure.
Is it possible to change the way you sleep or improve it, or are you like you are?
No. You absolutely can make changes. The healthy steps won't actually fix sleep disorders. Those generally require medical treatment, but there are a lot of things you can do.
Well, what are some tips for better sleep?
The biggest thing is really consistency. So you want to try to go to sleep and wake up at the same time every day, and really that includes weekends as well, because that consistency will kind of train your body and your brain to feel tired when you need to feel tired, and then ready to go in the morning. And then, like I mentioned before, don't set yourself up for failure. Don't drink caffeine or alcohol really late in the day, because that's going to cause problems. And a lot of people don't realize alcohol, even though it is a sedative, can actually cause you to wake up in the middle of the night and then have trouble falling back asleep.
So if you wake up, you should have another drink? I'm just kidding. What else can we do?
Yeah, I mean, really critical is having a good sleep environment, and a lot of people don't do this. You want to make sure your room is quiet and dark, and that it's at a comfortable temperature. A lot of people prefer a little cooler when they're sleeping. Some people use white noise machines to mask any of the sounds around you, house sounds or outside sounds. And then really, really critical is making sure you're putting down your smartphone. At least 30 minutes before bed. Your phone is going to stimulate your brain to stay active, and that's going to actually prevent you from falling asleep. And a lot of people know there's a blue light that comes from those artificial screens, and that can actually make your body feel more awake. So you want to make sure you turn off your blue light. There's a filter usually on your phone, and then wind down with something like a book instead of television or a phone. And
if you do wake up during the night, what's a good way to fall back asleep?
Yeah, I mean, there's a few things you can do. We use this method called the 4-7-8 method, which is where you inhale through your nose for about 4 seconds, hold your breath for 7 seconds, and then you slowly exhale through your mouth for 8 seconds. And it's basically just a slow breathing technique to help relax you. Some people may want to put on a little soft music or that white noise that I mentioned. That can actually help you fall asleep as well.
What are some things you should not do?
Yeah, the most important thing is don't sit there watching the clock. That's just going to create more anxiety. It's going to make you feel frustrated and increase your stress, and then you're less likely to fall asleep. And a lot of people may wake up and then go grab their phone and start reading their phone, and that's going to trigger your brain to say, hey, it's morning, I'm awake. Really critical, though, is don't sit there and lie in bed. If you sit there for 20 minutes or longer, you're probably not going to fall asleep. Get up, maybe get a glass of warm milk, do a relaxing activity, and then when you feel tired, try to go back to bed.
But any final advice, Doc? Because it's such to me, a magical, ethereal thing when you fall asleep. If you start thinking about falling asleep, then you're screwed. It's not going to happen, right? It just kind of happens. So any final advice?
Yeah, exactly. I mean, it's really hard to change our routines for a lot of things, but sleep in particular. So this is developed over a lot of years. Make these small positive changes. And like I said, consistency is critical. Stick with them, and better sleep is going to make you feel much better every morning.
Very valuable information. Thank you, Dr. B. Sweet dreams.
Thanks, Tommy. Have a great weekend.
You too, sir. If you want to find out more about People's Health, you can go to peopleshealth.com. You can call them at 1-800-978-9765, or you can visit the People's Health Medicare Center, 3017 Vets, right next to Party City in Metairie. Appointments are recommended, but walk-ins are welcome. Taking a quick break now, WWL First News.